healthcare proxy is a privileged position for someone to be in. Imagine you have been asked by someone who knows you, someone you care for generally, sometimes someone you don't know that very well, to stand in her shoes and speak for her at a moment when she can't speak for herself, and generally at a moment when she's at her most vulnerable. The fact that a person either can't make decisions on their own or cannot speak about those decisions generally means that they are in a situation where they're quite unhealthy, quite unwell, and perhaps dying. And so to be invited to be that person's healthcare proxy is a tremendous honor, it's a tremendous privilege, and it's a huge responsibility. The responsibility to be a good healthcare proxy would include doing your homework. First and foremost, checking in with the person for whom you are going to act as proxy. Find out what's going on, how is their health, if there is a disease present, how is the progress on that, what condition is the person in that you are speaking for. It is also important, when possible, to get to know the caregivers so that they know you, they know that you're doing this homework, and they're comfortable when the time comes that you are going to speak for their patient. So if you can get to know the caregivers, that would be wonderful. If you can get to know family members, particularly those that you either don't know very well or don't see very often, so that they too become comfortable with you in that role, that would be wonderful. But the most important person to spend time with, to discuss all of the possible decisions that may be facing him or her, is with the patient. You want to know what his values are. You want to know what her preferences are. You want to know what church teaching is about the decisions that may be likely in the face of the disease that that person is facing. So the responsibilities are extensive. They ought to be taken seriously. And yet, in my experience, both being a healthcare proxy and watching people who take that role very seriously become more and more engaged with and involved in the care of the patient for whom they will be proxy, it's a wonderful experience. It's an enriching experience. It's a sobering experience at times, but it's a very joyful experience because you're able to talk with someone about some of the most fundamental beliefs that they hold and some of the most important decisions that they will face. And if you take the responsibility seriously, the decision-making becomes a bit easier at a time when they can be quite stressful. I'm MC Sullivan, Director for the Initiative on Palliative Care and Advanced Care Planning.